Dr. I M. Jumpy has ordered a Pneumovac 1 milligram for our patient Skip Rocker, date of birth of 1/1/72. So I'll be administering that. The first thing I want to do is check the patient's 6 right. So right patient, right medication, right route, right dose, right time, and then of course right documentation. I want to stress the importance of hand hygiene, so I'd wash my hands before getting the medication ready and before administering the medication to the patient. And then I want to check the provider's orders and the MAR to make sure that I am got the right order. I will then go ahead and check the vial, and you want to make sure that there's no cracks in the vial. You want to check the expiration date to make sure that it hasn't expired. And we want the right syringe so that we can get the most accurate dose. And in this video, I will be using a 3 millimeter syringe because we want a half a milliliter to get 1 gram. And I'll clean and then another important thing is that you have the right needle, because you want to take in consideration the patient's muscle mass, and you don't want a needle that is too long that might hurt the patient, or a needle that is too has a diameter that's too big, because that again could hurt the patient unnecessarily. I'll clean the vial off with an alcohol swab, and I'll pull back and I'll put in a half milliliter of air into the vial, because that's how much medication we'll be pulling out. And we'll pull out and making sure that you get any air bubbles out. I'm going to recap the needle. And you don't want to recap the needle if you don't have to. You would only recap the needle if you're transferring the medication, the syringe and needle, to the patient room from where you got the medication ready in the med room, or if the sharps container was across the room, you can recap the needle. Otherwise, you want to just throw your needle and syringe into the sharps container. Before going into the patient room, I will make sure that I have everything I need. I will grab a pair of gloves and a alcohol swab. All right, so going into the patient room, of course, I'd knock, hello, Skip Rocker, can I just have you verify your name and date of birth? And I would check it with his wristband. I would also check his allergies, and he is allergic to Celebrex, so of course when I was checking the medication with the MAR, I would make sure that he would not have a reaction to this medication before administrating it. I would then, of course, wash my hands. Actually, before I do that, I'm going to show you where I'm going to be administrating this medication. And we're going to be putting it in the deltoid muscles. So to find that, you want to feel for this bony part right here, and then put 2 fingers down like that. And then you want to administrate it right after those 2 fingers right there. You want to make sure the patient's arm is either relaxed at their side or placed on something, securing it, a secure surface. So I'm going to wash my hands, put on my gloves. I'll take my alcohol swab. And again, I'll measure with the 2 fingers, and with my alcohol swab starting in the middle and using a circular motion, working my way out. And then I want to go ahead and let that dry before administrating the medication. I will take my cap off my needle with my non-dominant hand. I want to take and pull the skin tight and go in at a 90-degree angle. And with that non-dominant hand, I want to hold the syringe so I can aspirate. And I want to make sure that no blood comes out. If blood does come out, we then have to redo all of this, get a new needle and syringe and pull the medication out of the vial. Since there is no blood, I can go ahead and administrate this, and you want to do this slowly, taking it in between 5 to 10 seconds. All right, and then we'll go ahead and pull it out, and I will throw my needle and my syringe into a sharps container, and I can dab the surface with a gauze pad, and I can put a band-aid off it. I can put some light pressure on it to stop any bleeding that may occur, and I can then want to document the location of where I put in the vaccination and the medication that I put in and what time I did it at. And that's everything.